Hi, this is Craig Robinson from Robinson and Casey. One of the questions that we typically get from our families is, how do I choose the treatment center that my loved one will go to for treatment? And this is a difficult question. Actually, in Florida, there are about 1,200 licensed addiction treatment facilities throughout the state, many of which happen to be in Palm Beach County and Broward County, where we tend to work the most in. But this is a question that really goes into a lot of what the actual disorder is. Is there a significant mental health disorder coupled with the substance use disorder? It goes into insurance benefits and the family's ability to actually pay for treatment. There are generally three levels of, of treatment programs. There are treatment programs that accept in-network insurance, those that only take out-of-network benefits, and then those that don't take insurance at all and that are simply cash pay facilities. And generally, for the most part, what we have found is that for the most part, families really get what they pay for. And what that means is that if you utilize in-network coverage, for instance, your economic requirements and your financial responsibility is going to be less because you'll likely just have to pay your deductible and out-of-pocket max for that insurance. But generally what will happen is the insurance company will not cover all of the treatment that is clinically necessary for your loved one. So as I generally tell families, at some point in the process, there will be a conflict between what insurance is willing to cover and what your loved one actually needs. And so it's important that that be explained to families during the process, because a lot of treatment facilities are set up based on the insurance model. They're not necessarily set up based on what the clinical recommendations actually would be if finances were no issue. They are set up based on what insurance is willing to cover. And I think it's important for families to at least know their options. And so even if they want to utilize in-network benefits or out-of-network benefits to a certain extent, that they at least be informed that, hey, this is what we are recommending when your loved one's in a facility, and this is actually what insurance is willing to cover. And here is what it would actually cost to follow the clinically recommended pathway. And leave that option to the family so that they are more well informed and that they're ultimately being given the opportunity to set their loved one up for true success. Because the reality is that the longer a patient stays in treatment for addiction and mental health, the greater their chances of a successful recovery are. And so we don't want to see families be in a position where they end up cutting corners, so to speak, simply because that's where the insurance company told them to go. I think it's important that you have a treatment facility that, number one, be willing to push back against the insurance company and fight for more benefits and more time in treatment, but ultimately that families be well informed of the treatment process and how this works as far as financial responsibility. But ultimately, you, the family, have to be comfortable with the treatment facility that your loved one is going to. I will just say, I brought up mental health and co-occurring mental health disorders. A lot of facilities out there will advertise that they treat co-occurring mental health disorders, when the reality is that substance use disorders are really their specialty, and that they'll claim to be able to treat mental health disorders. But if your loved one has a truly significant mental health disorder, like a bipolar disorder, schizophrenia, schizoaffective disorder, it's really important that you do your research and find a facility that can really, really treat both and really specializes in both.